Welcome back, and Mark joins me now in the studio. Mark, what's first up?
Well, even while discussing important bilateral issues here in China, US President Obama's thoughts are bound to return home from time to time to America's healthcare woes. And it's not just the US that's planning healthcare reforms. The Chinese government is also attempting to improve its medical care system and insurance cover for its 1.3 billion citizens. In the northern province of Shanxi, it seems those efforts are starting to pay off.
More than 6,500 new clinics have been built across this coal mining province of 33 million people. A further 300 are planned. The Chinese government is on a mission to fix the country's ailing healthcare system. More than 300 million people in China have no health insurance. Cities like Beijing and Shanghai are home to some state-of-the-art hospitals, but for the majority who live in the countryside, medical care is rudimentary and often prohibitively expensive. One illness can ruin a Chinese family, driving everyone from white-collar workers to migrant workers and farmers to save around 40% of their household income for a rainy day. The government says it's taking the problem seriously. In January, it announced plans to spend $123 billion by 2011 to establish universal healthcare. The aim is to provide some form of medical insurance for 90% of the population. Each person covered by the system would receive an annual subsidy of just over $17 starting next year. Medicine would also be covered by the insurance. Here in Shanxi, as well as building clinics, the local government has said it will increase subsidies for rural doctors in the province.
I will improve my medical skills to provide better service for the villagers.
New clinics and higher doctor salaries won't be enough to cure all of China's medical ills. But for villagers here at least, it's a step in the right direction. Tom Mackenzie, BON.